Effective communication among healthcare workers is a daily requirement in our career. The most universal communication tool that we use is S.B.A.R. Welcome everyone to the Momma Nurse channel. I'm Vanessa, and here we discuss all things nursing, motherhood, and lifestyle. Make sure you leave a like on this video. Don't forget to subscribe to the channel, and make sure you hit that notification bell so that you don't miss out on any uploads. So what exactly is S.B.A.R? S.B.A.R is a form of standard communication typically used in the healthcare setting to communicate with doctors, nurses, CNAs, respiratory therapists. You name it, you use S.B.A.R. You may not always use the formal S.B.A.R setup, but it typically includes the basics at least. Now, the acronym S.B.A.R stands for Situation, Background, Assessment, and Recommendation. Now, let's discuss S.B.A.R a little bit further. Plus, make sure you stay tuned until the end for an S.B.A.R communication call with a physician. Now, let's discuss S.B.A.R a little further. S, situation. This is what is currently going on with your patient. What is the reason for your call? B, background. Why did the patient get admitted to the hospital in the first place? Have they had any rapid responses, codes, procedures, or surgeries? What are the significant or pertinent information that has brought the patient to where we are right now? A, assessment. Based on your current assessment, what has changed or what is concerning to you? I always recommend before you page a doctor, make sure you assess your patient and see if anything has changed. This will be very important in your call. You would want to include or make note of any vital sign changes, decrease or increase in urine output, or any drains that they may have. R, recommendation. This is your recommendation for the physician or for the patient. What do you think that the patient needs? Use your own judgment and expertise to make a decision on a recommendation. If you are a newer nurse or you're in a situation that you just don't know what recommendations would be appropriate, feel free to reach out to your charge nurse or a trusted colleague. If you know that you're calling a doctor who does not take well to recommendations, you may omit this portion. Sample call. Patient, 64-year-old male, admitted 2 days ago with shortness of breath. Situation. Patient's O2 saturation is 83% on heated high-flow nasal cannula, 40 liters, 100%. Patient has labored breathing and is using accessory muscles. Sample call. Patient, 64-year-old male, admitted 2 days ago with shortness of breath. Hi, Dr. Black. This is Vanessa in ICU. I'm calling in regards to your patient in room 202. His name is John Doe. He came in 2 days ago. The situation, the patient's O2 saturation is 83% on heated high-flow nasal cannula, 40 liters, and 100%. The patient has labored breathing and is using his accessory muscles. Some background information on the patient. He came in 2 days ago with shortness of breath, secondary to COPD exacerbation. He was previously doing well on 4 liters nasal cannula. Per my assessment, the patient is currently in distress based on my assessment. The patient's respiratory rate is 45. He has shallow breaths. He's flushed. His heart rate is currently 115, but normal sinus rhythm, and his blood pressure is 170/95, which is elevated compared to his previous reading. My recommendation would be to consult the intensivist for an emergent intubation, as I see a further decline for this patient. Do you agree with this recommendation? Will you be placing these orders? Thank you. Now, this sample call is standard for a seasoned nurse. Tailor S.B.A.R to your needs, your expertise level, and whatever setting you are in. Do you get nervous when you have to place a call to the doctor? Do you use S.B.A.R? Comment down below. What happened the last time that you used S.B.A.R? Did it work in your favor? As always, I hope this information was beneficial to you. Make sure you leave a like on this video. Don't forget to subscribe to the channel. And until next time, all love.